This is part 2 of me helping you study for your mental health licensing exam. In the first part, I talked about severity, and in this part, I'm talking about comorbidity. The reason that I group them together is because the test is going to try to trick you and confuse you to see if you know the difference between severity and comorbidities. So in the first part, I talked about severity, and in this part, I'm going to be talking about comorbidities. If you look at your questions and you determine that it's a comorbidity question, you're going to go back to your vignette and you're going to look for 4 different things. You're going to be looking for symptoms, you're going to be looking for life events, you're going to be looking for duration, and you're going to be looking for the word with. Okay? Let's start from the first one, symptoms. What's a comorbidity? A comorbidity just means that a person met the diagnostic criteria for 2 separate diagnoses. So a person can have an ADHD diagnosis and they can have a diabetes diagnosis. It just means that they have 2 separate conditions that met the diagnostic criteria for 2 separate diagnoses. So the diagnoses can be related, but they don't have to be related. And the test will often try to trick you with depression and anxiety because people think, okay, a person has depression and they have anxiety. The anxiety is a comorbidity. It's not unless the person meets all of the diagnostic criteria for depression and all of the diagnostic criteria for anxiety. If a person has depression with anxiety, it just means that they have a diagnosis of depression and some symptoms of anxiety, but not enough to qualify for a separate diagnosis of anxiety. That's where the word with comes in. If you see the word with in an answer and it's a comorbidity question, that's usually the wrong answer. Just remember that. So we're trying to figure out, does the person have enough symptoms to qualify for 2 separate diagnoses, or do the symptoms just fit one diagnosis? So if the symptoms can fit into one diagnosis and they have a bunch of other symptoms but not enough to fit into the criteria for a second diagnosis, it's not a comorbidity. Okay, now that's number 1. Number 2 is life events. Did the person take drugs before the symptoms came on? Did they have a traumatic event happen? Did they take a medication right before the symptoms came on? That's where duration comes in. If a person had a life event, you're going to automatically look for duration. How long after that life event or the drug use did the symptoms come on? Did they come on right away? Did they stay for a significant amount of time? Were they there before that thing happened? So duration is very important when it comes to comorbidities because you're trying to rule out everything else before you make a decision that this is a comorbidity. And there's one more thing that you have to remember. What's a primary and what's a secondary diagnosis? Primary diagnosis is just the one that's causing the most trouble for the person. It's the one that's impairing the person's life the most. So that's kind of where severity comes in. But with a comorbidity question, you're going to just want to figure out which diagnosis is impairing the person's life the most. And that's the primary diagnosis. That's really it. If you have any other questions, feel free to leave it in the comments. If you want me to talk about other things, leave me a comment. And if you're looking for a tutor, you can make an appointment with me through the link in my link tree that says Calendly. So I look forward to hearing from you and let me know if you have any other questions.